Taoiseach, People Before Profit is an all-Ireland party, and we believe that we need to move to a united Ireland, end partition. There are a number of groups and parties in this House would say, in one way or another, they subscribe to that view. I think now is a very opportune time, given the COVID-19 pandemic and how it has highlighted the sort of irrationality of partition when we needed an all-Ireland and need an all-Ireland approach to health, to dealing with the virus and so on. I'm very much from the James Connolly school of fighting for a different republic, and Connolly understood that if you were going to win people to the idea of a united Ireland, that it had to be a better united Ireland, it had to be a different Ireland. It shouldn't just be the pushing together of two states, dysfunctional states in many ways for most of their history. It had to be a better place. And one of the key areas, it seems to me, that you should be looking at your unit is the question of an all-Ireland health service. Because you see, why would anybody in their right mind wish to be part of this state when you're looking at a two-tier, dysfunctional, under-resourced health system with massive waiting lists, where nobody is really in charge because half it's privatised, another bit of it is run by this or that religious organisation. So I really want to shout out for the All-Ireland National Health Service campaign that's been established and ask you and your unit to really look at this, that unless we look seriously at establishing an All-Ireland National Health Service that really works, then that would take us a very considerable step towards convincing people of the argument for a united Ireland.
Bring people. Now, to Deputy Boyd Barrett's points in relation to the health service, I agree with your point. That's precisely what the shared unit can do. Is in the first instance, let's commission research in terms of the respective strengths and weaknesses of both health services, because there is a significant gap in terms of the health service in Northern Ireland and the health service in the Republic, and in both ways in some respects, and both have their challenges. But that does need to be worked out, and that does need to be thought through, and also in terms of what can we share. I know that on the Northern Executive side, one paediatric centre for cardiac surgery, for example, is agreed, and that's something in the new Children's Hospital and in Crumlin at the moment, that we would have an island-based approach to tertiary services in key areas that children require services, from cancer to trauma to cardiac and a range of others. I think it's very, very important. And also, I think we do need to repair and deepen relationships on the island, and that's part of what the shared unit will be about as well. And it will engage with people from different perspectives, different politics, different views, with a view to trying to get and develop a consensus on this. But we're never going to develop a consensus if it's going to be constantly sniping and undermining and saying you're not as pure as I am on the national question, which is what I'm getting on a repeated basis. It's no longer about whether you're the purest on the national question. It's about doing something pragmatic and significant in relation to issues like health, like education, like work. The North needs an economic transformation. I've said consistently about the North that the disadvantaged areas, both in loyalism and in nationalist areas, need a Marshall Plan in terms of school completion, access to third level. The levels are too low in some communities in the North and have been too low for too long. And I want the shared unit to delve into those areas, because that's ultimately how we build peace on the island and reconciliation and a bringing together of different communities, not through divisive politics.
Thank you.